Ulna, external features. This portion, which is the notch-like portion, that is superiorly. That notch-like portion, that is superiorly as well as directing anteriorly. Yes, that is the two main points for side determination. That notch, which is known as the trochlear notch, it should be superiorly as well as anteriorly. It is not like that, but it is like this. And then remember that styloid process comes medially. Radial styloid process laterally, ulnar styloid process medially. Okay, fine. So that's how. If I try to put it onto this side, then the styloid process will come onto the lateral side. So it's not that, it's like this. Now remember another point, there is a fossa, that is known as this which gives the attachment to the radius, that should come onto the lateral side. That is onto the lateral side. Even if you want to remember, this is a sharp border, that sharp border also known as the intraosseous border, that should also be lateral side. So these two main lateral side, this is the medial side, and this notch is directed superiorly as well as anteriorly. Now remember the upper portions. Yes, this portion is known as the olecranon process. Yes, and this is known as the coronoid process. There are two processes, olecranon process and coronoid process. And remember, between them there is a notch. Okay. Now onto the shaft portion. Remember, this is which border? Lateral border. And there are two another border, that is one that is known as the anterior border and another that is known as the posterior border. And surface is three surfaces. What are those surfaces? Anterior surface, medial surface and posterior. Remember, in radius there was a anterior, posterior and the lateral, but under the ulna we have which surface is anterior, posterior and the medial. Okay. Now remember the most important attachments. Okay, that's lower portion, that is known as the head of the ulna, and that is the ulnar styloid process. Okay, fine. Now attachments, remember most important one attachment. If you are asked to tell one attachment, then remember one attachment onto the olecranon process, and here there is a triceps. Yes, onto the posterior side of the olecranon process. Which is muscle? Triceps brachii. Okay, fine. Another most important muscle onto the coronoid process, and here that is known as the brachialis. Which muscle onto here? Brachialis. So remember two main muscles, triceps and brachialis. Now onto the majority part of the ulna, there is a one muscle, and that is known as the flexor digitorum profundus. Yes, onto the majority of the portion, flexor digitorum profundus. And lower part there is the origin of the pronator quadratus. So two main muscles here, flexor digitorum profundus and the pronator quadratus. Two muscles, brachialis and the triceps brachii. Now remember another some muscles. Yes, onto this portion, onto the olecranon process posterior side, there is a one muscle originating, that is the supinator, which is going from here to the onto the radius, supinator. And upper part here one muscle, and that is known as the anconeus. So anconeus and the supinator, anconeus and supinator. Now onto the posterior side, you remember three muscles. Yes, what are those three muscles? LLI, that is the abductor pollicis longus, extensor pollicis longus and extensor indicis. LLI. What are those LLI? One that is the abductor, another that is the extensor, and another that is the indicis. Abductor pollicis longus, right? And then extensor pollicis longus, and then extensor indicis. Thank you.